um, to talk about Dr. Suboohi. But before that, I also wanted to, a quote I came across, which was very much resonating with what we are trying to do.
There's some problem.
It says, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. And this is a quote by Margaret Mead. So as we are sitting here in this session of Bloom, and I don't need to introduce myself because the most of the people here are there. So don't need to introduce myself. I think this is very, very appropriate because that's exactly what we are trying to do. We're trying to change the way the world looks at menopause. We're trying to change the way India looks at menopause, how in India, people do not talk about menopause. They do not discuss their symptoms. They don't talk about their issues which are surrounding coming with menopause, and hence the group Bloom that is there. So welcome to this session with Dr. Suboohi. And for those of you who do not know Dr. Suboohi, though she's very, very popular on social media, and you see a lot of her on Gurgaon Moms and Facebook, I just thought that I should tell you about her. So Dr. Suboohi is a very well-known gynecologist in Gurgaon. She's also the vice president of the Gurgaon Ops and Gynae Society. So, and she has been practicing for 24 years in this space. She's obviously very, very qualified, part of multiple medical forums and societies. She presents paper everywhere. She does workshops. The workshops can range from adolescence to menopause. So she does it all. And we're very fortunate that she has, she's joining our cause and helping us look at changing the society. So Dr. Rizvi, very warm welcome and very happy to have you here.
Thank you, Malvika, and thank you, Yoshita, and thank you all for joining. Actually, I feel that at this hour in the afternoon, I don't know whether you feel like sleeping or just resting, having a cup of tea or something. So I'm really grateful to all of you for joining, because whenever I have a group of people, I always tell that it is not that only you will get change. You have got the power to change at least 12 people when you get enlightened. So I have kept my slides simpler, and I would be just coming along. You can write down the questions. I'll try my best to answer, because menopause is just not only a gynae discipline, it is a multidisciplinary thing. So there are mental issues, there are bone issues, and there are cardiac issues. So of course, whenever a person comes to us, we try to see which spectrum the patient is in, and then accordingly we change for the expert this thing. So I welcome you all once again, and we'll start with the presentation. So do let me know if you can see my slides. I'll put it in the so is anybody able to see the slides?
All of us.
We can.
Yes, and yes, I love the slide. Just love the slide.
We can.
Thank you so much.
Lovely.
Okay,
Yeah.
so I felt that in the afternoon we all need to be awake. So basically, we are all in a kind of scary mode, because as the youth passes away and we can see those fine lines, we don't really feel like looking at the mirror all the time, every time. And I don't know about others, but I can myself tell you that there was a time when I was very much appreciated about my skin, and I used to be very proud of it. But then there is a time that I see my eyes having those underlines and their fine skins, and of course, how we accept it and how we go ahead with it will make all the difference. So the idea today is that how we can see what are the changes and what better we can do. So we all know that we are not talking about menopause. Our mothers never talk. In fact, more consciousness is about mental health, but menstrual health as compared to the menopausal health, and the teenagers are being educated, but very few people have really taken initiative on this particular field. And for this, I would congratulate Malvika once again for coming up with this idea that we need to have this. So a big clap for you, Malvika, before I go. So most people are ashamed of many symptoms, and then 50% people who are having these problems are not seeking medical advice. advice, although most of the symptoms can be managed, but we tend to discuss it with other people, but not with the doctors. And then other people will give us some inputs, and then we go ahead with those notions for months together till the time that they become incurable. So I would just in my mind, there is a very well-educated couple who came to me with their mother with the swelling in the hand. So, and they were very well off. They came from Manesar, and they just told us that meri maa haath nahi utha pa rahi hai. And I said, okay, fine. And when I said, okay, I just let me examine her, and I found a fungating cancer from the breast going to the armpit. So a cancer had spread to the armpit, but neither the daughter-in-law nor the son could see that, or could really ask her that, and she was in shame to talk about these things. So it just came in my mind that how we don't discuss many things, and then so what menopause is actually a transition phase from reproductive to non-reproductive phase. So you see that there is a pre-menopause, which has got normal reproductive life, and then with perimenopause. It's like perimenopause is 3-4 years earlier than the last menstrual period. And then there is a menopause. So in the perimenopause, we covered 1 year after the menopause also, that comes the perimenopause. That is why it is called around. Peri means around menopause. And then we have the postmenopause, that we call it anytime after menopause is called postmenopause. Why is it important? It is naturally important because God did not want women more than 50 to reproduce. Like there is a body that becomes fragile, and if they start reproducing at that age, then the bones and the body is being burdened. So it was a nature's protective mechanism for women to bloom. Okay, so it is important for us to understand that that is the basic objective, and that is how the things were. So the average age in India is 46 years. Earlier than 40 years is called premature menopause. It is earlier than 38 now in India, that is called after 55 years also, then it's called delayed menstruation. Now, if you see the symptoms, there is a stage-wise symptoms of menopause. So in the perimenopause, you have mood swings, hot flushes, night sweats, vaginal dryness, irregular periods, and loss of libido. In the menopause, the hot flushes and night sweats start slightly decreasing, libido is decreased further, there's sleeplessness and vaginal dryness, and of course, menopause is amenorrhea. Like 12 months, if you don't have periods, then that becomes menopause. And the last month is called last menstrual period. The postmenopause, of course, we have osteoporosis, heart disease, urinary tract infection, incontinence, this risk of breast cancers, depression, and other cancers also increase. So why it is important for us to understand is that accordingly, we'll be investigating, and I'll be taking few of these things because, of course, covering everything is not feasible in this time, but I'll try the most to cover. So what are the basic symptoms of menopause? We see that there are hot flushes, night sweats, vaginal dryness, sexual discomfort. There can be depression. There's change in sex drive, there's sleeplessness, dry skin, weight changes, hair loss, and urinary incontinence. So what is hot flushes? I think most of the perimenopausal, even 35 years old, they observe it. And do send me, yes, if you examine it there in the chat box, I can just see how many of you are. So it's a subjective sensation of heat. Suddenly your skin, the cutaneous means skin vessels vasodilate, they dilate, and they suddenly cool down in 2 to 4 minutes. So there's sudden cooling. And that is why it is called flashes. So एकदम से ऊपर गया and एकदम से नीचे आया. So that is why. So there are different treatment options available जो बिल्कुल physiological है कि you can have cold water, you can dress in light clothing, and you can try deep breathing exercises. Okay, now you have raised your hand. Tell me now.
Yeah, hi everyone. So just a small question. Hot flashes, they say, can be due to many reasons. So how does one understand that whether it is due to this reason or it could be?
Yeah.
Is there a different way that they show up for you?
Yes. Yeah. So basically, you come to my next slide. When I come to the management part, there are 3 kinds. Whether you're having it mild, moderate, or severe. So mild is just feeling of heat without sweating. Okay, now moderate is feeling of heat with sweating, and severe is feeling of heat with sweating and palpitation that disrupts the usual activity. So first of all, you have to grade yourself in it, which grade you are. Okay, so moderate and severe ones, definitely consult a doctor And accordingly, she will tell you the test. I will be coming up with the test and the lifestyle modifications again and again in my presentations. So
Sure.
for this moderate and severe ones, she will be telling you about the lifestyle modification, hormone therapy, low dose oral contraceptive thing, and non-hormonal prescriptions that are required. So first you have to grade yourself and see how many times you get. Okay, you can rather have this lady found it a good way to cope the hot flushes. See, she can give just very roughly. Okay, so the second question is that weight gain, which all of us are bothered about, because suddenly we find that the genes that was a friendly genes to us, within a year it is no longer friendly. It's, well, you find it difficult to zip the genes. So their absolute increase in weight at midlife is not because of menopause. So every time anybody says ke वजन बढ़ गया है क्योंकि menopause हो गया, so that is not an excuse. There are hormonal changes that increase in the total body fat, especially the abdominal fat, even in lean women. So the mid-abdomen fat is basically many times because of the estrogen deficiency. So how do you manage these things? So maintenance of a healthy diet is foremost. Watch your calorie excess, and physical activity has to be there. You get your investigations done. I will be coming up with the investigations. You get the medical management, and then you can reduce the medicines are there that reduce an overall fat mass. They improve the insulin sensitivity, and then they lower the rate of this type 2 diabetes also. Okay, so these are all the things that are important. Now, the second thing that is important, and I felt that it was important for me to talk on, is about mental health. Okay, so mental health can be directly impacted by declining hormones level. The sex hormones affect neurotransmitters involving controlling mood. So there is low estrogen, and it causes a lot of dysregulation of the neurotransmitters. So there's reduced neurotransmitter level that affects the different ways. It disturbs the serotonin production, and they dysregulate the mood. So these are some of the things because of the low estrogen, which are directly from the brain, but they're indirectly other troubling symptoms like hot flushes, night sweat, and then sleeplessness, because of which you can be irritable. So the common psychological symptoms can be irritability, depression, and anxiety, forgetfulness, and mood swings. Many times we just start crying on small little things, and then they can just lose temper on the and small thing. Of course, there is low libido. There are pains because of which you cannot sleep. The memory also starts to fade, and many times because of loss of bladder control, you need to get up in the night, so your sleep is also not proper. So all these things cause more of these mental problems. So how do you manage such things? You have to exercise regularly, avoid drinking and smoking as much as possible, build a healthy support system, establish a proper sleep schedule. And I think, Malvika, for the support system, you are doing such this thing. That is a very good thing. Maintain a healthy diet rich in vitamins and minerals, prioritize taking days off, and get regular checkup. For the other things, of course, you have to find a hobby, and you can talk to your doctor, go for therapy. If you are in low mood for continuously 2 weeks, you should seek a therapist. And of course, if you have good family members, you can share with them. So now, what are the other problems? These are some of the hot flushes we have discussed. There is mid-abdomen weight gain we have discussed, and we have discussed some more things, but the mental health issues slightly we have touched on. What are the other things? We know that menopause, lack of estrogen affects the heart, the bones, painful intercourse can be there, slows the digestion, and the risk of cancers increases in this. So we'll be taking up one by one. Initially, whenever you are going to a doctor, if you are having any symptoms, the initial tests that are easily done are like a complete blood count, a urine test can be done, fasting blood sugar, HbA1c, lipid profile, thyroid profile. These you can easily order from your own, like without visiting a doctor also, you can order from any of the labs. For the pap smear, a transvaginal ultrasound, and mammogram, of course, you have to visit a doctor. Why I have put a slide of pap smear? Because cervical cancer is still a major cause of killer, and 1 in 8 women is dying of cervical cancer. The death because of cervical cancer is more than the death because of the pregnancy in India. So in India, we are very much conscious, and the idea is to cervical cancer Mukt Bharat. Like we want to make India free of cervical cancer, and that is why this slide is there. It's a very simple test, the pap smear, which we take. We put a small spatula here and take out the content and put it in the tube and send it for investigation to see if there is any precancerous lesion. So the cervical cancer screening is to see the precancerous lesion. It's easily preventable cancer, and it is only cancer that is transmitted by a virus, that is HPV virus. So I just thought it is important for me to mention it. And once your pap smear is normal, you can get it repeated after 3 years. And if you get an HPV testing also, you can get it repeated after 5 years. You don't need to get repeated after 65 years of age if everything is fine. Now, this is very important because this is the thing that most people don't say. These are the genitourinary symptoms. So you see before premenopausal and postmenopausal what happens. The erectile tissue, the folds in the vagina, the muscular lining and the inner lining, they all tend to decrease as the estrogen is lost. So there is loss of fold and loss of inner lining and the glandular function. So it becomes dry and the folds are gone. So because of dryness, there is irritation, there is pain during intercourse, that's called dyspareunia. There is recurrent urinary tract infection, the sexual dysfunctions, and that is why many fights occur in the home. Then there's pelvic floor symptoms occur because of dysfunction of maturation. So defecation and the prolapse and sex and pain, all these things happen because of the lack of support to the pelvic floor as well. So that's there. Now, what is incontinence? The hormonal changes during menopause are the main cause of urinary incontinence among middle-aged women. So the low estrogen and progesterone weakens the pelvic floor muscles. So there is loss of bladder control and there is incontinence. So the pelvic floor loose ho jata hai, to bladder control lose jata hai. So that is why it is always important to have your pelvic floor exercises when you are pregnant and after that also, post-delivery also, which I teach to all my patients, because then later on during menopause, the pelvic floor is stronger and you have to continue with the pelvic floor exercises. That's important. Now, there are types of incontinence. There are 3 types of incontinence in women, and all are equally normal and important, actually. One is a stress incontinence. Like the moment you cough, something leaks. That is called stress incontinence. Because of the detrusal muscles, at times they become very active. Then you have this urge incontinence, that you are not able to control your urine. And then overflow incontinence, like whenever there is the bladder, it keeps on dripping. So that's called overflow incontinence, that the bladder capacity is decreased and the patient passes urine. So all these things, the urinary problems can be tackled. How you can prevent them? Like you have to stop smoking, have to have a good vascular flow in the vagina. So the sexual activity is strongly encouraged, has to be encouraged. Cranberry juice is supposed to be good, although not medically proven. There are conflicting, but of course it's good. Vaginal dilators can be seen if there is too much of a problem in cases of sexual dysfunction. Then hormone therapy helps, and locally available moisturizers as well as locally available vaginal estrogen is a good thing in cases of vaginal sexual dysfunction. Now they have come up with fractional carbon dioxide laser also. Some doctors are doing it. And of course, some vitamins like E and D also help. So the management of urge incontinence, you have to reduce your coffee and tea and see how much fluid you are taking, especially in the night, decrease your weight. And of course, exercise is important and you have to stop smoking. Then the behavioral bladder training has to be done if you're going to the bathroom again and again. Then pelvic floor muscle exercises are important. Your gynecologist can teach you whenever you want. Then few drugs are there that are important, and you can take these drugs according after the doctor's prescription. And in cases which are resistant to any of these things, then the surgical treatment is taken care of. So along with that, because of all these things, there is a depressed mood. So antidepressants for mood swings or depression can be taken. Water-based lubricants during sex to make it more pleasurable. Lubricating the vagina helps with dryness and pain, and regular exercise, meditation, and other relaxing things. And of course, a diet rich in phytoestrogens, such as whole grains, cereals, flaxseed, chickpeas, legumes help. You can make a smoothie out of it, and I'll tell you the recipe of a smoothie when I'm done. Thank you. So coming up, the second thing that is again very important is perimenopausal bleeding. So why I have taken up perimenopausal bleeding is that many times when the patients come to me, they say कि हमें तो सबसे कह दिया था कि महीने खत्म होने वाले हैं इसलिए महीने गड़बड़ हो रहे हैं. Okay, that is partly true. But whenever you are having bleedings that is not irregular, do get a gynae checkup done. The gynecologist will get an ultrasound done as well as a local examination to see if there is a local cause to the bleeding, or your cervix is bleeding, or the cause is in the uterus. So that is important. So what happens near menopause, that the estrogen decreases, so the, of course, the ovaries are running out of eggs, the ovulation becomes irregular and the shedding becomes irregular, so that you get irregular periods in the perimenopausal. But whenever there is acute abnormal uterine bleeding, it requires immediate attention. And then if it is, there is chronic, like for the last 6 months it is happening, then you need to get your doctor's this thing done, a consultation done. Of course, perimenopausal, you have bloating, cramping, water retention, and fatigue. These things happen. So the causes of abnormal bleeding. Oh, Yoshita, tell. Ask me.
What is the acute abnormal bleeding? What do you mean by that? How do you know it's
Okay.
acute?
Yeah. So acute abnormal uterine bleeding means any bleeding. And like if I simply tell you is that if you are soaking 2 pads in 1 hour for 2 consecutive hours.
Okay.
Okay. So that is acute heavy bleeding, for which you need to consult a doctor. That is one of the things. The other thing is that even if it is not soaking 2 pads per hour for 2 consecutive hours, if you think that your bleeding is heavy and requires immediate attention, then it is called acute bleeding.
Okay.
Okay, so it's like that. You don't need to wait for the another hour if you're feeling giddy, or there is like if you are not able to get up and you think that these is unusual clots are coming out, then don't wait for 2 hours to see the doctor. Fine, that's there. Okay. Anybody else has raised their hand? Okay. So the causes of abnormal uterine bleeding are important. And why is it important is that if you should have a view that how things. So first was anovulation. What I discussed was anovulation. Then there can be endometrial polyps. There can be uterine fibroids. There can be adenomyosis, endometrial hyperplasia, or vulvar, vaginal, and cervical lesions. So, okay. So lower down lesions can also cause bleeding. In the postmenopausal age group, if the bleeding, so what I tell my patient is that if you are having menopause, okay, like no menses for 12 hours and 12 months, like no menses for 12 months, and if after that, even if you have one drop of blood, even after that, then you should consult your doctor. So fine. So it is like perimenopausal is different and postmenopausal is different. Postmenopausal, no menses for 12 months. But then if you have a drop of blood, do consult a doctor, because there are more chances of endometrial hyperplasia and cancer in this age group. Of course, there is endometrial atrophy, vaginal atrophy, hormonal causes, but endometrial hyperplasia and cancer is to be like evaluated and taken care of. So how does the investigations of perimenopausal bleeding occurs? We have already discussed about the pap smear. Pregnancy test is always important, even if the patient is she has got ligation. This is important in the cases of perimenopausal age group. Postmenopausal, of course, your doctor has got the discretion to say how young you are. Okay, then prolactin and thyroid is important. CBC and coagulation studies, and LFT, RFT. What is otherwise from a doctor's side is a transvaginal ultrasound, sonosalpingography, MRI, endometrial biopsy, and hysteroscopy. So all this is important. Why I'm writing endometrial biopsy, and I've shown a picture, because the moment I tell a patient that you would require an endometrial biopsy because your endometrium is thick, okay, in the postmenopausal group or a perimenopausal group, they don't turn a back to me. They'll go because they are scared of getting a biopsy done. So this picture is a very, very honest replication of what we do. We put a very fine cannula from the canal from which your menses come. That's called cervical canal. Very fine cannula is put, it is rotated, and the cells are taken out simply by a small section. It's an OPD procedure. It is not painful. And then this is given for examination to see if there is any cancer cell in this. Am I clear? Yes or not?
Yes.
Should I repeat?
Yes, absolutely clear. Thank you.
Okay, thank you so much. So this goes to the vagina through the same canal through which your menses come, and it's just taken out and the cells are given. So whenever any of your doctor is telling you for an endometrial biopsy, please don't run away. It is for your own benefit.
Actually, everybody gets scared by the word biopsy.
Yeah,
Any
that is
biopsy,
why I
they
thought
just
this was my last inclusion in my. So then, of course, whenever you are bleeding and you've got yourself checked, then there are drugs, medicines. There are simple methods like Trapic MF, which I call if you're bleeding too much and there is no problem, you can take medicines like Meftal TX or Trapic MF. Then there are hormonal methods, which your doctor can suggest. Then there are surgical methods. If you're bleeding too much, then surgical methods go DNC. Like I showed you about the endometrial biopsy, DNC is slightly more than that only. The instrument that goes in slightly thicker and it takes out the content that is bleeding. Then you have hysteroscopy. Myomectomy is taking away the fibroid. And if you have fibroids which are bleeding, then they can be just sealed with embolization or the endometrium ablation are there. So this is basically for me to teach the doctors. And I just wrote it here so that you can have it. Now, अभी दिल की बात करनी है. अब जरा मैं कुछ पहले chat देख लूं कि क्या क्या है. I'll just see.
So, Dr. Suboohi, I do want to ask you a little bit about hormone replacement therapy, because that's something I am very curious about. Ki, how does one get oneself tested to see do we need hormones?
Yes.
Kya karna chahiye?
Yeah. So, Malvika, I have included the whole thing in the presentation. I just paused to see if there is something that I need to answer right now. So we come to the heart diseases. So
in fact, I had put a question in the chat where.
So I'll just pack up this. There are a few more slides left, and
we'll wait for the end.
Because most of the answers you will get in this. Okay. So
but I think there was a question I had put in the chat when you were talking about the probability of cancer and all increasing, and I do believe that there are vaccines which are out, which taken at the right age, kind of avoids you. And I don't remember the name, but I remember taking them. That I think the 6 months you have to do 2 vaccines or something like that.
0, 2, and 6, and 0, 1, and 6.
So is there anything beyond a certain age, or like, for example, if you look at influenza or some of the other vaccines, there are upgraded versions that keep coming in depending upon viruses and changes. So does the same hold true for this also, or once you have taken at that age, you don't need to repeat that?
Yeah, if you have taken all the 3 shots, you don't need to repeat them. Although they have come up with Gardasil 9 now, which is like slightly has got a better spectrum. It's around 18,000 rupees. So it has got Gardasil 9 for cervical cancer. But if you have taken the 3, there is no need to get a repeat. That is what they claim.
Okay.
That is what they claim.
Yeah, no, I remember, and that's why I thought I'll ask you this question, because this was something which was I remember because the gynecologist is more family than anything else. I remember when it was there, she ensured that I'm taking the vaccine, and obviously spoke to my mom and everybody that even kids. But is there a right age? Because it's not just about us. I mean, some of us have daughters and all also.
So, Konika, what I'll do is that the age is 9 to 45 years of age. 9 to 26 is the one they want. 45 is the upper limit if they want to take. Okay. So, cervical cancer and its prevention and its treatment is a topic I'll take any of these days whenever you want. It's the most common topic that we discuss in all the awareness programs.
No, because you mentioned it. That's why I thought I'll check on that, because it's
exactly good.
Interrelated.
Initially I was not going to mention, but then I thought that many people will join for the first time and they should know that the PAP screening is very important. Like as a responsible citizen, I thought that it should be there. Okay, so about Dil Ki Baat, 1 in 3 women have some form of heart disease. So about 10 years after menopause, the number of women who have heart attacks peak. फिर हम females जो हैं different होते हैं ना. Why? How we are different is like the male. This thing is. So we have the males. What happens? We can detect by angiography in males which are the blocked vessels. In females, they have microvessel disease that cannot be seen by angiography. Okay, so the angiography misses it, and we think हमने करा ली angiography तो हमारा सब कुछ ठीक हो गया. But then angiography misses it, and mortality is twice that of men. क्योंकि हमें तो दिल के दर्द की आदत पड़ चुकी होती है. So we are not actually all the time feeling कि हमें कुछ हो रहा है, and we tend to ignore, and then we land up getting a heart attack. So it is underdiagnosed, undertreated, and poorer outcomes than men in management of myocardial infarction. Fine. Underdiagnosed, undertreated in the most developed countries. This data is from the most developed countries. In India, many people just die without knowing that they ever had a heart attack. Heart thing. Okay. Now, what is important is that the postmenopausal has got a lower estrogen level, and that leads to deposition of pericardial fat that increases the risk of heart disease. The small fat things you need. So this is one thing that I wanted to say. So, and more women with PCOS are more prone. Did I switch to this? Yeah. So they are more prone to heart disease because there is insulin resistance, there is low LDL-C, there is central obesity, बीच में से fat जो होता है, there is hypertension in them, elevated CRP, homocysteine levels are elevated, there's left ventricular hypertrophy, increased atrial size and diastolic dysfunction, and coronary artery calcium scores and carotid intima media thickening is more in cases of patients with PCOS. So PCOS, whenever I see a teenager with polycystic ovarian disease, I just tell him, please don't stop coming once your babies are born, because it's a kind of a lifelong risk that has to be evaluated and corrected every time. Fine. So how do you manage heart disease? You have to manage depression. Okay. Because the more you are depressed, the more the stress hormones are released, more the arteries can be constricted. So if the arteries constrict, you are more likely to get heart attack. You have to see that the smoking has to be like completely omitted. Obesity has to be managed. Then exercise is one of the things that is always in all the menopausal symptoms is important. Physical activity is important. And diet is important. Okay, Konika Chadda, tell me, you want to ask?
Yeah, so tell me now, how does somebody know that they're developing a cardiac kind of a problem? Like you say,
that is what comes
palpitation.
in the management. That is what I am trying to tell you. The target, you get a lipid profile done. Okay, you get a lipid profile
No,
done.
I'll tell you why. Because a very close, I mean, my first cousin actually, she just had a heart attack 20 days back.
Yeah.
And she is not even 45 years old.
Yes.
And blood pressure high being is very normal and all, but somehow she could not detect it.
Exactly. So that is why these awareness workshops which Malvika has planned is there, like what we can do. There are certain things that will not be in our control, but what can be in our control is get a lipid profile done. If your LDL should be less than 100 milligram, high density should be less than, not be greater than, it should be greater than 50 milligram, the good cholesterol we call. Triglyceride should be less than 150 milligram, and on non-HDL cholesterol should be less than. So if you find these things going up, if you find these things going up in your baseline test without any symptoms, you should go to the doctor, and the doctor can put you on statins, aspirin, multivitamins, and hormone replacement therapy. Now, what other tests with that are important whenever you are having a baseline cholesterol, that is a baseline ECG is important. The blood test we have already discussed. Blood test will also tell you whether you are having sister diseases. So what are sister diseases? If you are having lipid imbalance, the sister disease is diabetes. So if you are having hypertension and you are having diabetes, then you are many times more risk of getting a heart attack, because in diabetes, a silent heart attack happens. Okay, so if the doctor will always tell you to get a HbA1c along with that, a fasting and a postprandial sugar done to see if you are having diabetes or if your kidney functions are not proper. So basically, all these things are acting in the body through different routes, but they constrict the vessels and the heart vessels, because many times they are micro vessels, they are not detected by angiography, and the females don't have the symptoms because otherwise also the females are made to believe that dard sehna hai hame. So they keep on tolerating and they keep on taking much pain without complaint. So that goes for the heart problems which are there. The idea of today's presentation is to just sensitize what are the areas we have to look into. Now, osteoporosis, that is one of the things I think most of you may be aware. Jaise menopausal and perimenopausal, and most of you are actually exercising and following a diet regime because you have seen your grandparents and parents really suffering from osteoporotic fractures. Like my mother had her knee fracture, then she had got her knee replacement done, then she had a spinal fracture, and now she's on bed. My grandmother had a hip fracture and a knee fracture, and she was bedridden, and she died because of that, because fracture immobility leads to one or the other thing. So it's a very important, and it's a silent killer. Your body will not tell you that आपको osteoporosis हो रहा है, but it's a silent killer. So you have to see that a condition that it makes the bone brittle and fragile from loss of tissue, typically as a result of hormonal change or deficiency of calcium and vitamin D. So there's increased risk of postmenopausal, because at the moment you are menopausal, 5 years from that, your risk increases many folds, and your peak bone mass is at 30 years of age. Okay, so it's not that for 50 pe hum kahe abhi hum calcium kha lein. So of course it helps, but you have to understand that from 25 to 30 is the best time to invest in your health and take care of things that are not good for your bones. So you see how the bone actually is not a static tissue. It is a mobile. The calcium comes and get deposited, and it's a mobile tissue. So how it becomes more porous with age and how the risk increases. So you see that.
Sorry to interrupt. Can I
Yeah,
just quickly ask a small
yeah,
thing?
sure.
Like, if at all you know that there's a family history of arthritis, or you've seen, like your mother, I've seen my mother and
Yes,
grandmother, and you are
coming
at
up,
like 44, and you
coming.
don't. Okay, okay.
Coming. So I've tried to see. Okay, so
No,
the
it's
peak
just
bone
that
mass.
I'm lactose intolerant and I'm not supposed to have milk in anything. So I
Yeah,
was just
don't worry.
asking. Yeah.
Don't worry. Okay. So milk also, nowadays we don't prescribe too much to this thing. So there's increase in bone fragility, and the risk of fracture of wrist, spine, hip, ribs, humerus increases. And in Indian females, they are having inadequate nutrition. That is, the proteins are lacking, vitamin D and calcium lacks in the food. And of course, we have a sedentary lifestyle. जैसे जैसे हम बड़े होते हैं, हमारे पास हमें मैनेज करना आ जाता है बहुत सारी चीजें. And most of us are spending at least 8 hours in a day sitting on our chairs. So that happens. So you see that the 9 common causes which I just took from the net was that estrogen deficiency, which happens in menopause and starts perimenopausally only, mineral deficiency, hypothyroidism, genetics, smoking, excessive alcohol, inactivity, and all these things, and medications like corticosteroids. Anybody who's on steroids is more at risk of these fractures. So there's a screening for osteoporosis. Okay, so you get a DEXA screen done, and they give you a T score. So if your T score is less than or equal to 2.5, or there are presence of fragility fractures like compression spine fractures, then you are at the risk of having fractures, and you should take the treatment if the T score is less than 2.5. And if the T score is more than like -1 and 2.5, इसके बीच में अगर है, तो if you are having additional risk factors, which includes the family history, okay, then you should seek treatment from the doctor. Okay. And and of course, whenever these are there, you have to get all these lab investigations. In the particular, of course, it's a serum calcium that is important. Serum phosphorus is important, fasting for phosphorus, and then vitamin D we are all getting done. Thyroid is important because we see that hypothyroidism and hypo, and X-ray thoracolumbar spine is the first thing you should get done with before getting in this thing, and parathyroid hormone evaluation. So when you get all these tests done and they can just measure your risk, then they can start treatment. And it's of course understandable that it is not entirely preventable. Exercise, especially the weight bearing exercise, is very important. Food which is high in calcium like cheese, yogurt, spinach are important. You can get fortified cereals that are there available. Many of these Kellogg's are having fortified. Calcium supplements are important, vitamin D supplements, and HRT. So HRT in this hormone replacement therapy is especially very useful in patients who have a family history, who are having initial osteopenia also. So there's a window of opportunity. If you are going early to the doctor, they can start low dose hormonal replacement therapy to you. So that is one thing in postmenopausal. Now, so what can we do? We have learned so many things, but there are few things which we all can do. We can get a pap test done, get a pelvic examination, a breast examination, and a mammogram done. You can schedule annual appointments. And if your doctor tells you to come 6 monthly, do go to the doctor. You get the bone density screening done by the DEXA scan you can get, or a plain X-ray. Talk to your doctor about all your problem. Exercise, walking, yoga, strength training, everything helps. Food like fruits, vegetables, lean meats, and whole grains help. You have to avoid salt and sugar both. So both of them are not very useful, okay, because salt leads to increased blood pressure and many other things. You have to limit your alcohol intake if you are having, and of course, stop smoking and change your time. So this is all. Thank you so much. And let's bloom as we all mature. I'm Dr. Suboohi Rizvi. Thank you. Now, about the things which you wanted to ask, I will just take the questions. I'll just see. Okay. Okay, but I forgot. Should I take the questions, Malvika, first? Or you want to say
go ahead. No, please take the question. I think people want to know. This is very, very, very important. And there's so much here. I think it would require so many more sessions to get into the depth of things.
Actually, it is. I'll honestly tell you that none of my presentations have taken this much time as this particular, because it had to be, it has taken much of my time. In fact, my mother was going to disown me now. Okay, it's either your clinic or your lectures. So it has taken time. What I have not specifically taken too much is HRT in this case. I have touched on HRT, and why it is important to understand. HRT has got 2-3 very good roles. One is in genitourinary syndrome, like sexual dysfunctions. If you're having, then it is a very nice thing. It has got a role. It has got a role in osteoporosis. That is a window of opportunity. But what you need to get evaluated are the tests which I have been telling all the time about the test. So it is important that we get all the baseline tests done. And if you are not having any lipid problems or any sugar problems, and your ultrasound is showing a normal uterus, your breast is not showing anything. So because all these medicines have, the research period has shown different side effects on different individuals. So, but they are at the same time very useful also. But it's not like that HRT is like a bad thing. So HRT is a good thing if it is given for reasons for which it is given. Like osteoporosis is one thing that can be prevented to a large extent, but of course it cannot be totally prevented. It helps. It's a low dose HRT is helping. The same goes with sexual dysfunctions. If your vagina is very dry, the estrogen creams that are available can help you a lot. But before that, do get a checkup done by a doctor so that she can rule out if there is anything in the cervix. Although vaginal estrogen does not have that many side effects as compared to the oral estrogen, which we take for the HRT in cases of osteoporosis.
Okay, thank you.
Any other
Yoshita, you have a question?
Yes.
Yeah. Actually, thank you so much, Dr. Suboohi. I think it's very, very useful. Really, I think I'm actually reeling against under कि कितना कुछ गड़बड़ हो सकता है. So right now, feeling very scared actually. But
really?
can we? Yeah, I am actually. But I wanted to ask you. I think firstly, most of us are in our 40s and maybe we've missed the bus on taking the cervical vaccine. So can we get a cervical vaccine now? Like I'm 40.
It's allowed up to 45. Yeah. See, there's no harm in taking. It's allowed up to 45, 46 years. It's allowed that. You know, get a pap smear. The first thing is that get a pap smear done. You know, and then get a cervical cancer vaccine also. You can take just 2 shots also instead of 3 now. And the government of India now, yesterday I attended this cervical cancer conference in Leela. They told, ek bhi de do Indians ko to bhi chalega. We want 90% coverage of all the girls to prevent actually the cervical cancer in India, because it's been delayed and it's expensive. So government of India is coming up with cheaper vaccines in a month or 2, where we'll be giving to all the college on the school girls, as well as, of course, 45, 46 years will come. When you will come, we'll catch you for the pap smear and the transvaginal scan. Will not let you go. Pura vasool kar lenge aap.
So basically, अब हम लगवा सकते हैं baby. I'm
45,
I'm
46 if you're 45, 46, you can get done. At least 1 shot will be good. So basically what this vaccine is doing, it's important to understand that there are many HPV strains which cause with cancers. Okay. So this vaccine is for those viruses which are causing most of the cancers, but not all. So the efficacy of vaccine is around 80 to 90%. So anybody who has got the vaccine done should not feel that there is no need for pap smear. Okay. Am I clear on that? कि बहुत से रिश्तेदार हैं, HPV के बहुत से रिश्तेदार हैं, कुछ रिश्तेदार की वैक्सीन बन गई है, बट बहुत सारे अभी भी ऐसे हैं कि जो चल ही रहे हैं. Okay. For a very informative session, my question has been covered. Oh, thank you so much,
So
Neha.
I also wanted to ask you another question. Now, my mother has loads of heart lifestyle diseases. She has everything, and she had a stroke also. So obviously that makes me more worried about things. She had a tummy. She has depression, which she doesn't know, but all the other things are there: high blood pressure, diabetes, thyroid, and then stroke, which makes me very, very worried. About myself. And also because I have been living under a very stressful mental state for a very long time.
Yes, I know.
हाँ जी. और दूसरा मेरे साथ जो हो रहा है, I mean, this is not a consultant. I'll come back and talk to you on a consulting basis.
No, it's fine.
But मेरा right arm, not left, right arm gets numb. Just any time. So I have been thinking that I should get an entire heart checkup done anyway. जैसे आप जो कह रही हैं वो सब जो है वो अब निकलेंगे कि नहीं, but I've made a note of that and I will get some of these things done.
Yeah. So basically, numbness of hand can be because of two reasons. Two main reasons. है ना? One is that the vitamin B12 deficiency, which is very common. Okay. So the health profile checkup, which is there in the packages which I get from my clinic for the patients, it covers vitamin D and vitamin B12. And surprisingly, my B12 was also very low. So I got lot. अब रोज अंडा खाया मैंने कहा नहीं ऐसे कैसे काम चलेगा. So it is important that you get your B12 done along with the whole thing. The second thing that can cause you numbness is maybe you are sleeping in a posture that is really pressing it in a way.
Also. It happens that I'm sitting.
Okay, then it can be. Yeah, then it can be because of vitamin B12 deficiency. But baseline investigations for all the people who have a genetic cause of like having their parents who are hypertensive or had a stroke should get a complete evaluation that should include lipid profile. And I underline this all that I had taken this heart workshop with Medanta in my community center. And I told that females have all the kinds of heart diseases. The only thing is that they are so used to carrying the pain with them that they evaluate. And there is one particular syndrome that's called broken heart syndrome. Okay, that happens with females because every time they take in that emotional baggage, there's a part of heart that goes inactive or there is ischemia. So suddenly the heart starts changing its shape. And so all of you, please go back and read about broken heart syndrome in females.
So must be there, I'm sorry.
हमारे तो बड़े करीब बहुत बारीक
चेकअप कराना पड़ेगा, तो कभी भी नहीं कराया.
So that is important.
Doctor, the test that you mentioned for osteoporosis, where and how is that done?
It's a very, I showed you a table and this thing. So it's a simple way, like the way they take the X-ray. That's how our DEXA scan is done. And it's done in all the centers that are having the X-ray machines. In all these centers, which are a good center, diagnostic center.
So it's a full body thing that they do?
They scan the things and they tell you about the spine and the pelvic bones, especially they scan and see. And lately they have come up with this ultrasound machine also to detect BMD. That's called bone marrow density. In fact, today I was going to have a camp, but then I had promises with Malvika, so I had to finish my OPD. So that is also a very easy way that we can conduct and detect the bone marrow density by ultrasound scan. So they have a machine that's a portable machine that is not that accurate as DEXA scan, but then of course something is better than nothing. So they are doing it a portable machine also. But otherwise, if they give a proper DEXA report, you need to go to any of these centers which have got an ultrasound machine, and they've got an X-ray machine, not an ultrasound, and they'll do it.
So should you self prescribe it, or is it only for people who have high risk of osteoporosis?
No, see,
Because sometimes you're subjecting
yes, yes.
yourself to
So
X-rays and all.
basically, if you are having a high risk of osteoporosis or your first generation, so there is a scoring system that who all can have. So if simply explain karo. So if you think that your height is decreasing, you are having constant backache, or any of your family people are first generation are having osteoporosis and practice, then you can go ahead with that. And I guess that you can self-prescribe also. Otherwise, I can write it for a free for you.
No, what I'm
And send you.
okay. So, osteoporosis is
Otherwise,
different
it is
from
not the most essential.
osteoarthritis.
Yeah,
Is osteoporosis different from arthritis?
yeah. Osteoporosis is different from arthritis. Arthritis is having an inflammatory element in it. Okay,
Okay.
so it's called a what we call as it is an immune body immune against your own self. Like so, it's arthritis is different from osteoporosis.
Okay.
Osteoporosis we all will go through. Arthritis we may or we may not. So for arthritis also, our package has rheumatoid antigen testing. The package which we give from our clinic, for which you can get your arthritis seen, whether you are having rheumatoid arthritis, antigen raised or not. Monica, you want to say something?
Yeah, I actually wanted to ask one thing which I didn't see, and maybe it's not related, is having varicose veins. Does that also come up at this, in this stage?
Yeah, see, basically, it is not that it does come up, but you have to understand that as the estrogen goes, the support to the muscles goes. Also, the support at many of these muscles and intima and lining goes. Okay. But so if you are in a profession of prolonged standing, okay, or your otherwise mid-abdomen obesity is there, then your veins can have varicosities there. The return, the venous return is hampered. So
Oh, because,
anything, any way
yeah,
your calf muscles are not being used to that extent, then you can have varicose veins.
because I've started kind of noticing that with me, and
Yeah.
my mother has vasculitis. She
Yes.
also had varicose veins, and lately I feel that, swelling,
Yes.
difficulty in walking,
Yeah.
that kind of thing has
Yes.
started coming
Yes.
in.
Yes. Yes.
And I mean, that's why I'm asking, don't know,
Yeah.
is it related or is it
Yes, it
independent from this?
see estrogen is a very nice hormone which has been maintaining this divar for long. But what
Okay.
we do is that we take this for granted and then it starts falling like this. Then we have it. It's kind of a physiological thing, but of course it becomes pathological because we are not actually doing many weight bearing exercises as well. So of course we have to bloom in a way that we have to go from this world, but at the same time our lives have changed. Like our forefathers used to work in fields, and our great grandmothers would be pulling out the pulley from the well. So all these work we don't do now, so our muscles become, we are a Maggie generation, or maybe not a Maggie but a pseudo Maggie generation. So our bodies are not having enough nutrients to support, as well as our lifestyle has changed. So that is the thing.
And the second one, sorry for this. I
It's
think
okay, don't
that
need to be sorry, I'm here.
okay. So I have had a myomectomy before I was 40.
Okay, fine.
Okay. And what has happened is, in between I was fine, and then lately again, I've been like what you were talking about, maybe in a pre-menopause stage, I got some of these hormone tests and all done, and I was also said to I probably need to go in for another checkup because it's time. But there was a possibility for the DNC called out. Now I was not very sure when that DNC is done, because there were polyps, there were fibroids, and there were cysts which were detected in the ultrasound which was there, and we was told to give it some more time. And I just wanted to understand, when you mentioned about DNC as some procedures there, when does that, when is it used, when does it typically get used?
Okay, first of all, tell me, are you menstruating or you're not menstruating?
It's erratic.
Erratic. Okay. So if you go for any, like if it is erratic, my suggestion will be go for an ultrasound. That's a transvaginal ultrasound. They will
Hmm.
tell you about your endometrial thickness.
Hmm.
Okay. So if your endometrial thickness is more than 7 millimeter, okay, it is better to get a DNC done. Okay. If postmenopausal and your endometrial thickness is 4 millimeter, more than 4 millimeter, get a DNC done.
Okay, okay, okay. Got it. Those are the kind of benchmarks. Maybe I'll separately have a follow-up session with you
Yes.
so that I can share what I have with me.
Yeah, you can come to my clinic.
Sure.
I'll do your transvaginal scan. I'll do your endometrial thickness and I'll let you know.
Sure, sure. Thank
Okay,
you.
Malvika. So,
Yeah.
time for chai samosa.
Yeah, and I must say, it was a lovely, lovely session.
Thank you so
And
much.
you are so sweet, Dr. Suboohi. I mean, it's totally
Oh,
out of the way, but I just love interacting with you. I mean,
same this side.
the way you
Same
talk
this
and
side.
all, it's very nice. So it's very
In this side.
beautiful.
So
Yeah.
yeah, I haven't covered cancers in this, like the breast cancer, the uterine cancer. I've just touched a little bit. We can anyway, any of these days, we can, I mean, month, we can just type, because of course you say that the one person can make a difference, and वो कहते हैं ना, वो वाला शेर है ना, कौन सा, मैं अकेला ही चला था जाने बे
जाने पे
मंजिल
मंजिल
मगर
लगा, लोग साथ
लोग
आते
साथ
रहे,
आते
कारवां
गए और
बनता रहा। ये
कारवां
ब्लूम का
बढ़ता गया.
कारवां है और ये
So
बन रहा है. So, no, really looking forward to more session. I know you were very busy the rest of the month, so we did it here. But
yeah,
we'll
actually,
take our
so
time. I want more people to be aware and join. So I'll take the video and post it.
don't worry.
And if
All
anybody
these like
wants to see
Rinku
the
and
presentation, Hanji,
in
yeah,
yeah, say they
yeah.
are going to tell other people also about
Oh,
the session, about
100%.
what they have
Yeah, yeah.
learned, and so that way it will be good. Okay, so keep on blooming, keep on shining, and take care of your health. And
Thank you
goodbye.
Thank you
so
so
much.
very
Thank you
much.
so,
Thank
so
Thanks
much.
a
you.
lot.
Thank
Same
you
this
so
way.
Bye-bye.
much.
Goodbye.
Bye.
Thank you so much. Bye.
Everybody. Thank
Thank
you
you.
so
Thank you
much.
Thank
so
you so
much.
much.
Thank
Thanks,
you.
everyone. Bye.